highest maternal mortality. 1,600 women were dying per 100,000 live births. That's a mortality rate that's 100 times higher than what we see in the US and other industrialized countries. Pregnancy was a death sentence. In fact, Sierra Leone was labeled as the most dangerous country in the world to give birth. Sierra Leone is a very poor country, limited resources, very few doctors. There were just a few years ago, less than 10 OBGYNs and pediatricians, and less than 300 midwives for 8 million people. But then something happened. The country decided that enough was enough, and communities demanded and joined together with the government and decided to take action on maternal health. They decided that no woman should die while giving birth. I was born in Sierra Leone. I moved to the US as a teenager, specifically to become that type of doctor that would keep women safe from dying during childbirth, because so many women in my family had died. So I became an OBGYN and epidemiologist, and after a career working for the Centers for Disease Control and for Kaiser Permanente in Georgia, I moved to Sierra Leone in 2017 to work with the World Health Organization and to help the country set up her first maternal death surveillance and response system. We supported the Ministry of Health to investigate every single maternal death in the country, to learn from those deaths, and to use that information to come up with strategies to prevent the next woman from dying. Communities and community leaders were charged with protecting and caring for moms. Families and traditional birth attendants provided psychosocial support for women. The communities came together to provide food and financial support. Non-profit organizations like ours, the Mama-Pikin Foundation, created, similar to the birth kit, a delivery bucket and transportation assistance to incentivize women to deliver in a health facility and to keep them from walking miles in labor. Most importantly, the government started a free healthcare initiative for every single pregnant woman and lactating mother. And women stopped having dangerous home deliveries with lay and untrained attendants, and they moved to having deliveries in birth centers with midwives and hospitals. The government started training more midwives, increased the number of midwives by 5 times, and more doctors, and working to improve quality of care in hospitals. In fact, our organization in 2000 helped the government start the first residency training program for pediatricians and OBGYNs in the country, and we graduated the first 3 pediatricians last year, and are on track to graduate 8 OBGYNs this year. So Sierra Leone provided a protective cocoon of care around their mothers, layers of health workers and services, and an enabling environment to keep the mother-baby dyad safe. Over the past 20 years, maternal mortality has steadily dropped by 75% to 443 deaths per 100,000 in 2020. So when Kaiser Permanente recalled me back home to Atlanta to work on decreasing maternal mortality in Georgia and create a perinatal patient safety program, I looked at those learnings from Sierra Leone and worked with our team to implement those elements, some of those critical elements that worked in Sierra Leone, and to adapt them for use here in the US. We started Kaiser Permanente's first maternal death surveillance and response system in the Georgia region, and have since expanded that. And we provided those layers of midwives and doctors and nurses and licensed clinical social workers providing psychosocial support around our moms. Those layers of evidence-based care, data-guided care, care without bias, and we ensured easy access to this care, telehealth, and promoted and supported time of work for our moms. We did add technology like remote blood pressure monitoring, and we started to see results and improved outcomes. We published our findings in the New England Journal of Medicine Catalyst last year, and we're now continuing that work in the US and also continuing work in Sierra Leone. Maternal mortality is still unacceptably high in Sierra Leone, but the country is making major strides and is on track to meet the regional World Health Organization goal of less than 200, of a maternal mortality rate of less than 200 in the next few years. Sierra Leone taught us that the most important thing in decreasing maternal mortality is a commitment by the community and a commitment by the government to make change. Resources are important. Resources are critical, of course, but the most important thing is that commitment. Thank you.